Welcome to my video blog series, Moving Out of the Problem into the Solution. Today, I want to talk about utilizing an integrated approach for chronic pain management. I've been thinking a lot about this lately, and I just wanted to share this video blog with you. Most of you that have been following me know this, but I've been living with my own chronic pain condition for a long time, 1982. I've also been working professionally for over 30 years developing the addiction-free pain management system. I've written numerous books, and my new book that is in the final processes of writing and editing is Thank You Adversity for Yet Another Test, a body, mind, spirit approach for relieving chronic pain suffering. I'm very excited about this particular venue. This book is going to be the culmination of a lot of years of research and outcome measures from the 3 years of the program that I developed and was the clinical director for the past 3 years. When it comes to chronic pain and chronic pain treatment, chronic pain management, we have a serious problem. As you can see, everybody's lined up for the pills and surgery window, but when it comes to lifestyle change, nobody wants that. They don't understand that. They haven't been told that that's what they need. They bought into being passive recipients of the biomedical model. And the lifestyle change is challenging. And it's challenging because it has to be done on 4 levels: biologically, psychologically, socially, and spiritually. And that's a lot of hard work, and some people have a challenge with that. So I like to explain the synergistic treatment problem this way: the coexisting chronic pain, addiction, mental health syndrome. When people have chronic pain, they often decide to go to first their general practitioner and then maybe to a pain doctor or a pain clinic. Now, when it's discovered that they have co-occurring mental health issues, they refer them out and often don't even collaborate very well with the mental health providers. If the person is experiencing an opioid use disorder or problematic medication management, they might be sent to an addiction treatment professional. This is what leads to a series of sequential treatment episodes with nobody really being the case manager and nobody really realizing that they're dealing with a syndrome. A synergistic syndrome means 1 + 1 + 1 = 4 or more now. And what this syndrome needs is concurrent treatment instead of sequential treatment. This synergistic treatment problem needs a synergistic solution. It needs to be integrated. What I mean by that, it needs a team of healthcare professionals who are going to be assessed and provide concurrent, targeted, and collaborative treatment using an evidence-based manualized treatment curriculum. That's why I developed the addiction-free pain management treatment system. Its goal is healing the whole person. And using a cohort model means that we start people together, build team and rapport using that manualized approach. And for example, if we have a team of workers' comp patients, a team of first responders, a team of military vets, we can use a cohort model. The cohort model also means that the people in that program are teammates with each other and help each other go through the manualized treatment. One of the big stumbling blocks for good treatment outcomes for people with chronic pain and coexisting opioid use disorders is not having access to medication-assisted treatment, MAT. Only about 1/3 of the people that really need it are going to get it, and for someone with chronic pain, it's essential. But I also don't believe it needs to be a blanket intervention. It needs to be, first of all, recovery-friendly, individualized, and evidence-based, and I really include the idea of starting low and going slow by starting with the minimum effective low dose and titrating up as needed. The compliance monitoring is about doing urine drug testing to make sure people are taking what they're supposed to take and not taking things they're not supposed to take, which will lead to better treatment outcomes. I also think the solution should include core non-medication based, non-pharmacological, and what used to be called holistic practices. So we want to reevaluate people's overdependence on the traditional biomedical model and help them transcend that biomedical model. The body, mind, spirit approach helps people reorientated, going towards healing the whole person. In the biological area, as you'll see in a little while, it's not just the medications, but it's diet, nutrition, exercise, for example. Psychologically, we need to see how living with chronic pain has impacted people's ability to think and manage emotions. They might have pre-existing mental health problems, or they might have a trauma condition that never got resolved. Isolation from family, friends, and community is another one, so we need to make sure there's a strong social family component to the healing. And the missing link for a lot of treatment programs is the spiritual, not religious, but spiritual, helping patients identify and then build their spiritual values, practices, and principles. What we see here is how we need to tie it all together. These are just some of the interventions I think are necessary. It would take many, many different slides to list all the different interventions in each of the four quadrants. But the four quadrants are tied together, and I see the spiritual as the glue that holds the whole thing together. Using a cognitive behavioral restructuring approach is really crucial, but it's got to start with our beliefs and perceptions, our mistaken beliefs and distorted perceptions, because it's those that lead to the thinking patterns, usually negative, self-defeating, or depressive or anxious, or whatever those negative thoughts are, lead to uncomfortable emotions. Thoughts and emotions lead to urges or impulses, and if thoughts are addictive thoughts with uncomfortable feelings, craving to use something inappropriately is the urge. Urges plus decisions lead to the behavior or the action, and for every action there's a social reaction. So this has been a very powerful part of programs that I've developed over the years. People need to have breathing space, though. They need to be taught how to bring their stress levels down so they can get in a peace-centered place and start identifying those beliefs and perceptions, their problematic thought patterns, their uncomfortable feelings, and learning some tools to manage emotions better. How do you have an impulse or urge or craving management plan in place at the decision point? That is what's really important. So it's simple as this. The problem solution modality. Once we identify the thinking, we need to help people develop better ways to challenge and start developing more positive thinking patterns. Teaching them how to manage uncomfortable emotions. Emotional management always starts with changing how you're thinking about the emotions. For urges, we have a system that's called put myself in timeout or pause. Then relax. The relax is bringing my stress levels down, so I'm thinking clearly. But then once I get to that point, I can reflect on what got me here and what do I need to get out. Then the decide is making that decision. What is the best next step that I need to take? And then I need to implement that next step. I need to get into action. And for every action, there's a social reaction. So this is where I need to develop a team of accountability partners to help me be more successful. So we're just about at the end, but we're not really over yet, because I want to challenge you to write down what are the most important things that you learned by going through this video blog. And what are 4 things that you can commit to do differently to achieve improved levels of functioning and quality of life. I am challenging you, if you're a pain patient, absolutely, this is crucial, but let's say you're a healthcare provider. How is this going to help you? Well, it's going to help you practice what you teach to your patients. So it's really important to come up with this call to action. Then identify what might get in the way. What are the obstacles that could sabotage my action plan? And who can I pull in to be an accountability partner to help me be successful? So as I say, onward and upward with hope, and I hope that this video blog has provided some help and support in ending the chronic pain, trance, and the suffering that many people occur. I believe that freedom from suffering is not only possible, but it's very possible if you're willing to do the work. Thank you for joining me today. I really appreciate your time and attention.